Thank you for holding this important hearing. I want to commend President Biden last night as well for underscoring the need for us to come together around issues that I think everyone here in this committee agrees are nonpartisan and deserve our direct attention. Ms. LaBelle, in your testimony, you spoke about social determinants of health, which impacts substance use. In my district, the city of Hartford, a community which has deep poverty levels, accounts for over 25% of accidental overdoses. What policies do we need to pursue to address this addiction holistically?
Thank you, Congressman. And I'm very familiar. I'm from Connecticut. I'm very familiar with Hartford. I actually was there last year with the Office of National Drug Control Policy. And I think there are a couple things. First of all, there are good harm reduction programs that exist in Hartford. They get people who may not be receiving services elsewhere. They get vulnerable populations the help that they need. They get them naloxone. If they inject drugs, they get them syringes that can prevent them from having infectious disease. So that's one piece. I think the prevention programs, there are also examples of good prevention programs in that area that work to build communities of care that have wraparound services for families. So those are a couple things. And then lastly, I mentioned in my testimony, I'm a strong believer in the child tax credit to help families experiencing poverty, to lift children out of poverty, and also to address some of the adverse childhood experiences and trauma that often accompany poverty. So those are three areas that I believe strongly in that can help in that area.
Thank you for your answer and your clarity. With that, Mr. Chairman, I yield back.